Hello, my name is Brandon Reed. I'm an exercise coach in Northampton, Massachusetts, and I'm going to talk about and demonstrate some exercises for training during pregnancy. When training during pregnancy, obviously you want to check in with your physician first, as well as a personal trainer. It's probably a good idea to get someone that's an expert and can show you how to do these exercises correctly with the right form and at the right level of intensity. Now, other factors would come into play as well, whether or not this is a first, second, third, or beyond pregnancy, whether or not you're already training or have never trained. Today, again, I'm going to talk about just the basics while training during pregnancy. If you have an existing exercise routine, you could continue to do that, adjusting the intensity down as you get closer to your delivery date. If you've never trained before, again, I think it's a good idea to check in with your physician or a trainer to make sure it's good for you to start a program. So when training through pregnancy, you want to think about a couple things. Most important is posture. There's going to be some excess weight on the front side of your body, so there's going to be some pressure into that low back. So you're going to want to be keeping the core tight, the belly button drawn into the spine, and the shoulders back and the head up. So when we do our exercises today, we'll make sure we keep that in mind. You're also going to want to remember that balance is also going to be important. You're going to want to make sure you're on a stable surface using weights that are comfortable for you to perform your exercises with good form. We're going to start with a split squat. You're going to get some dumbbells that are comfortable for you to finish about 10 repetitions and take a split stance, keeping the shoulders back, the chest up, the belly button's drawn into the spine. I'm going to drop down and back up. This will target the thighs, the glutes, and the hamstrings. After you get 10 of those, switch feet, and you've got 10 on the other side. Breathing in on the way down and out on the way up. Targeting the same muscles on the other side of the body. After the split squats, you'll do the bent over rows, and the dumbbells will come in front of your body. Get a comfortable stance, bend yourself over, keep the core tight. Depending on where you are in your pregnancy, it may be too much to have this position with the low back, so you may want to skip this exercise. Then you're going to release the dumbbells and bring one up at a time. Keeping the back straight and breathing in as you bring the dumbbells into you and out as it goes down. When you're done with 10 or 20 total, 10 on each side, 20 total, we'll stand back up and you'll work the curl and the press, one arm at a time. Again, keeping the shoulders back, squeeze the glutes, squeeze the hamstrings tight. You really want to work on the posture and all the muscles that help keep the posture good. And then press these dumbbells overhead, 10 on each side. We'll make 20 total. Good. When you're done with the curl and the press, you'll do the deadlift, or what we call the sumo deadlift. The dumbbells down in front, and you'll squat down and up. And again, using a dumbbell that's comfortable, you may be able to use something a little bit heavier than the previous exercises. Breathing on the way up and out on the way down. Or a breath pattern that's comfortable for you. After 10 of the sumo deadlifts, you can take a little break, maybe do a little walking, riding on a bike, maybe a little treadmill jogging. It's really going to be up to you and where you are in your pregnancy and what exercises you can handle. That's a circuit for training during pregnancy.